Viewers, let's get you the breaking news coming in. You'd remember Karnataka Chief Minister Siddaramaiah sparking concerns over COVID vaccine after shocking incidents of cardiac arrest. The Chief Minister had raised a question, which was after 23 deaths were reported in 40 days in the Hassan district of the state. The CM had asked, is there a link between these deaths and the COVID vaccine? He in fact had blamed hasty approval and distribution, leading to several medical experts coming out to slam him, saying that such doubts could be detrimental to public health if people start doubting vaccines. But after his government's expert panel, his own minister has now countered him. According to the Karnataka Health Minister, there is no negative impact of vaccines. That's the latest rebuttal that is coming in for Chief Minister Siddaramaiah, who has been linking COVID-19 vaccines with the cardiac arrest cases that the state has seen in the past few days. My colleagues Imran and Neha join me on the broadcast for more on this. Imran, once again, the Chief Minister of Karnataka being rebutted, being refuted, his claims of the link between cardiac arrest deaths and COVID-19 vaccines now being refuted by his own health minister, saying there is no negative impact of vaccines, clearly calling out the fake claims that the Chief Minister has been making.
Well, absolutely. In fact, their own government report has come out with all the details, saying that there is no impact connection between the COVID deaths which have happened and also the rising increase of heart attacks. They say that the study which has been done by them, by the Jayadeva Institute of Hospital, the Chief Ravindranath, and along with in the field, found that there has been marginally 4 to 5% increase in heart attack cases, but that's due to other risk factors. They found no direct evidence of COVID vaccination leading to the heart attacks among patients who have tried. They conducted autopsy of the patients, and based on the studies done for over the 100-odd patients there, they have come out with this report. Now, let me remind our viewers that over this issue, there was a lot of controversy had driven out. In fact, I think that the Chief Minister's statement over this issue that, whether COVID vaccination is there, it has led to a lot of apprehensions on the vaccine. Vaccine has done a good job. The Chief Minister retorted back, saying that there's a lot of concerns raised by the people whether the vaccination has led to the heart attacks.
Right.
And there is no harm in clearing doubts of the people. That's the reason why the study has been done. Now, right now, just a few minutes back, the Health Minister, along with the chairman of the committee, did a press conference, say that primarily they have not found, the studies have shown there is no between vaccinations and the rising number of heart attack disease. It's more due to smoking, health and other risk factors.
Right. So behavioral, lifestyle, genetic inclination is something that has been told by medical experts, that there is a link between cardiac arrest cases that have been happening across the country and the kind of lifestyle and genetic inclinations that people have. But let's listen in to what Minister Gundu Rao has said, and then we'll get you how medical experts have been fact-checking Chief Minister Siddaramaiah on his claims of COVID-19 vaccines being linked to cardiac arrest cases.
ನಾವೀಗ ಸ್ಮೋಕಿಂಗ್ ಬ್ಯಾನ್ ಮಾಡಿದೀವಲ್ಲ ಪಬ್ಲಿಕ್ ಅಲ್ಲಿ, ಸಾರ್ವಜನಿಕ ಸ್ಥಳಗಳಲ್ಲಿ ಸ್ಮೋಕಿಂಗ್ ಅನ್ನ ಮಾಡಬಾರದು, ಮಾಡೋದಕ್ಕೆ ನಿಷೇಧ ಇದೆ. ಅದರಿಂದ ಅದು ಒಂದು ಕಡೆ ಅದು ನಾವು ಹೇಳಿದೀವಿ. ಆದರೆ ಕೆಲವರು ಮಾಡಿದ್ರೆ ನೀವು ಅವ್ರ ಮೇಲೆ ಕಂಪ್ಲೇಂಟ್ ಮಾಡಬಹುದು, ಕೇಸ್ ಬುಕ್ ಆಗ್ತದೆ.
All right, so let's also get you how the Indian Council of Medical Research has been fact-checking Chief Minister Siddaramaiah. There is no link between vaccines and the cardiac arrest deaths that we are seeing across the country. First of all, the ICMR has said that there is no link between the vaccines and reports of sudden deaths, and that is something that medical experts across the country have been reiterating. Counter number 2 to Chief Minister Siddaramaiah is that COVID-19 vaccines in India are safe and effective, something that the Chief Minister had questioned as well. Underlying health issues play a role in sudden deaths. Remember, all through COVID and the vaccine administration, comorbidities is something that doctors warned about, that those with comorbidities and underlying health conditions will be more vulnerable. Unfounded claims could contribute to vaccine hesitancy is something that medical experts across the country have said after what Chief Minister Siddaramaiah said, that if you make such claims that are false, that have not been proven by scientific research, it will lead to vaccine hesitancy. Something that we do not want in this country, especially pandemic spreading. Let's listen in once again to what Minister Dinesh Gundu Rao has said about the cardiac arrest cases.
ನಾವೀಗ ಸ್ಮೋಕಿಂಗ್ ಬ್ಯಾನ್ ಮಾಡಿದೀವಲ್ಲ ಪಬ್ಲಿಕ್ ಅಲ್ಲಿ, ಸಾರ್ವಜನಿಕ ಸ್ಥಳಗಳಲ್ಲಿ ಸ್ಮೋಕಿಂಗ್ ಅನ್ನ ಮಾಡಬಾರದು, ಮಾಡೋದಕ್ಕೆ ನಿಷೇಧ ಇದೆ. ಅದರಿಂದ ಅದು ಒಂದು ಕಡೆ ಅದು ನಾವು ಹೇಳಿದೀವಿ. ಆದರೆ ಕೆಲವರು ಮಾಡಿದ್ರೆ ನೀವು ಅವ್ರ ಮೇಲೆ ಕಂಪ್ಲೇಂಟ್ ಮಾಡಬಹುದು, ಕೇಸ್ ಬುಕ್ ಆಗ್ತದೆ. ನಾವೀಗ ಸ್ಮೋಕಿಂಗ್ ಬ್ಯಾನ್ ಮಾಡಿದೀವಲ್ಲ ಪಬ್ಲಿಕ್ ಅಲ್ಲಿ, ಸಾರ್ವಜನಿಕ ಸ್ಥಳಗಳಲ್ಲಿ ಸ್ಮೋಕಿಂಗ್ ಅನ್ನ ಮಾಡಬಾರದು, ಮಾಡೋದಕ್ಕೆ ನಿಷೇಧ ಇದೆ. ಅದರಿಂದ ಅದು ಒಂದು ಕಡೆ ಅದು ನಾವು ಹೇಳಿದೀವಿ. ಆದರೆ ಕೆಲವರು ಮಾಡಿದ್ರೆ ನೀವು ಅವ್ರ ಮೇಲೆ ಕಂಪ್ಲೇಂಟ್ ಮಾಡಬಹುದು, ಕೇಸ್ ಬುಕ್ ಆಗ್ತದೆ.
So that is, of course, Karnataka's Health Minister, citing that there are other reasons and not COVID-19 vaccines that are linked to these cardiac arrest cases. My colleague Neha also continues to be with us to get us more on this. Neha, it seems one setback after the other for Chief Minister Siddaramaiah. Rather embarrassment for him with the kind of claims that he's been making. First, his own expert panel refuted his claims. Now his own health minister saying that there is no negative impact COVID vaccines, and in fact there are other factors that contribute to COVID, to cardiac arrest deaths, and those can be linked to genetics and lifestyle and not vaccinations.
Well, that's absolutely right, Shreya. Of course, we've seen the manner now in which the Karnataka Chief Minister initially, of course, had said that the and deaths that were taking place because of the cardiac arrest were owing to the COVID vaccine. But now, even as the government, of course, had ordered a committee there to probe the deaths, and of course, that committee, while not particularly probing the Hassan deaths, while probing overall if there's any link of cardiac arrest to the COVID vaccine, has come out there and made it quite evident that there's absolutely no connection, particularly specifically say of the vaccines with the cardiac arrest. Today the Karnataka Health Minister, of course, also coming out there clarifying that the COVID vaccines, of course, needn't necessarily have any link to these cardiovascular diseases, but also the fact that other factors such as smoking and a host of other habits as well is what has been leading to these cardiac arrests. Like you rightly pointed out, of course, now even as you had the ICMR, as you had health experts as well, as you had people, tycoons in the pharma industry like Kiran Majumdar Shaw and others also coming out and correcting the Chief Minister. Now the own government, of course, here having to fact check the Chief Minister. We'll really have to wait and see where politically also this controversy dies down.
That's right. Neha and Imran, thanks very much for joining us at the moment. We'll keep coming back to you for the latest that is happening in Karnataka and what experts and ministers in his own cabinet are saying as far as the Chief Minister's claims are concerned. But remember, viewers, we have been telling you how Siddaramaiah's own expert panel had refuted his claims. The Union Health Ministry had also allayed concerns, saying there is no evidence to suggest that COVID vaccine is causing sudden deaths. In fact, citing extensive studies by the ICMR and the National Center for Disease Control, the Health Ministry has said that the issue had been looked into by multiple agencies and that the claims were unfounded. Now, the Congress finds itself on the back foot here, claiming that the government just wanted clarity.
ಬರೀ ಹಾಸನ ಜಿಲ್ಲೆ ಅಲ್ಲ, ಇಡೀ ರಾಜ್ಯದಲ್ಲಿ ಈ ರೀತಿಯ ಆಂಟಿ ಕೋವಿಡ್ ವ್ಯಾಕ್ಸಿನೇಷನ್ ಇಂದ ಆಗಿದೆ ಅಂತಕ್ಕಂಥ ಹೆಚ್ಚು ಪ್ರಚಾರ ಏನು ಆಗ್ತಾ ಇದೆ, ಅದಕ್ಕೆ ತೆರೆ ಎಳಿತಕ್ಕಂಥದ್ದಕ್ಕೆ ಈಗಾಗಲೇ ಎಕ್ಸ್ಪರ್ಟ್ಸ್ ಕಮಿಟಿಗಳು ರಿಪೋರ್ಟ್ಸ್ ಗಳು ಎಲ್ಲ ಬಂದಿದ್ದಾವೆ. ಮತ್ತೆ ನೀವು ನೆನ್ನೆನೂ ಕೂಡ ಟಿವಿ ಮಾಧ್ಯಮದಲ್ಲಿ ನೀವುಗಳೇ ತೋರಿಸಿದ್ರಿ, ಡಾಕ್ಟರ್ ಸಿ ಎನ್ ಮಂಜುನಾಥ್ ಅವರು ಹೇಳಿರ್ತಕ್ಕಂಥ ಅಭಿಪ್ರಾಯ ಎಲ್ಲ ನೀವು ಕೂಡ ನೋಡಿದ್ರಿ. ರವೀಂದ್ರನಾಥ್ ಅವರು ಈಗ ಹಾಲಿ ಇರ್ತಕ್ಕಂಥವ್ರು ರವೀಂದ್ರನಾಥ್ ಅವರು ಕೂಡ ಇವತ್ತು ಕೂಡ ಪತ್ರಿಕೆಯಲ್ಲಿದೆ, ನೆನ್ನೆನೂ ಕೂಡ ಟಿವಿನಲ್ಲಿ ಹೇಳ್ತಾ ಇದ್ರು. ಸೊ ಈಗೆಲ್ಲ ಇದೆ, ಇವೆಲ್ಲ ರಿಪೋರ್ಟ್ಸ್ ಗಳು ಅಂತಿಮ ಆದ ಮೇಲೆ ನಿಖರವಾದಂತಹ ಕಾರಣಗಳನ್ನ ನಾವು ಕೂಡ ಸಾರ್ವಜನಿಕರಿಗೆ ನಿಮ್ಮ ಮೂಲಕ ತಿಳಿಸಬಹುದು.